have seen some trials now suggesting, one from Spain and I think one from United States, led from Birmingham, suggesting that maybe transplant might not be required so frequently anymore particularly when you're using these sort of 4-drug regimens together, such as carfilzomib, lenalidomide, dex, and dara, or as we just talked, VRD dara. So what do people think about that? Is transplant still with us, and if so, for how long? Peter, Tom, maybe, what do you think?
Well, so I would point you to the Forte trial, where the Forte trial randomized patients to KRD12 versus KRD8 plus a single autologous transplant. And in that study, essentially the people that were non-high risk did well whether they received a transplant or not. So I think KRD in that setting might be enough, and you might not need to do an autologous transplant in that setting. However, in the high-risk population, it still was a benefit.
We're involved in a trial called the MASTER trial, which is involves giving KRD dara. And then it's also an MRD-driven trial, and this has about 112 patients accrued at 6 different institutions. And we can really tell that the MRD negativity rate goes up even with a 4-drug regimen post-transplant, and it's substantial. And so I think, if we end up using MRD as sort of a surrogate endpoint or to limit therapy, I think that'll be very interesting. But I have to put myself in the pro-transplant camp, that I think it really does provide benefit to patients. And I am very interested to see about long-term data with Forte. But
this is Dr. Costa's trial, right? The master.
Yes, that is.
Yeah.
Right.
Not his trial, but he's the presenting.
Yeah, right.
That's the one I meant from Birmingham. So in that trial, they all get transplanted. Is that right?
They can be transplant ineligible. That's allowed, but the majority of patients have gone on to transplant.
I see. Okay, understood. So jury's still out, but for the time being, people are still transplanting. Peter, is that the case with you?
Yeah, I would say so. And going back to the Forte trial, the transplant arm did have a higher proportion of patients with sustained MRD negativity. And I think sustained MRD negativity is probably more important than MRD negativity in one single point in time.